Now on to this, the Democratic Nursing Organization of South Africa, DENOSA, is unhappy with the Minister of Health's recruitment plan. Health Minister Dr Aaron Motsoaledi announced yesterday that the department will only recruit 200 nurses. Joining us is Kwena Manamela, DENOSA's General Secretary. Kwena, thank you so much for your time and for joining us this afternoon. So as an organization, you have expressed deep disappointment in the minister's announcement. What does the recruitment of only 200 nurses signal about government's priorities in addressing South Africa's healthcare crisis?
Good afternoon, and thank you very much for inviting us. Yes, indeed, today we released a statement that we are actually not very happy about what the minister announced yesterday as an outcome of a health council. We are really not happy because we really not sure what method did they use to come up with the numbers that they came up with, because our conviction is that during COVID, although we said it many times even before COVID, that COVID exposed a lot of things that are not well done, that are not done well in government. One of them is the shortage, the severe shortage of nurses. We needed the nurses at that time, and then it showed that it's very critical that we do that. And we have never recovered from that period of COVID. But post-COVID, we thought government will try by all means to close that gap in case we go back, because we will never know when will we have another pandemic. So the country must always be ready. But instead, we are regressing and asking ourselves, what method did the council come up with the 200 nurses? Remember that the nurses are needed 24 hours around the clock. As I said, during COVID, it showed that there should be a nurse all the time, without blinking, around the patient, depending on where that nurse is serving. So if the numbers are going down and down and down like that, and we find the numbers like that, because previously we could understand because they raised the issue of the austerity measures and the budgets. But we are not kids that we were promised all the time. But when that promise we thought now is coming to fruition, we are given 200 nurses. It's just a slap on a wrist. It's just a drop in the ocean as far as we're concerned. So we're actually not happy about the numbers. We are not going to compare the numbers to other numbers that we see that they have released as the Health Council to say they will hire this number and that number. We are concerned about the one of the nurses, because even the statistics are saying the nurses are in the majority, and they're the ones that should look after the patient around the clock. So if you give such numbers, it really gives a lot to think about.
Right. I mean, you speak about never having recovered from the losses of COVID-19. There's currently a projected shortfall of 100,000 nurses by 2030. How should the department respond to this realistically?
Yeah, I think there should be a priority. Government should concentrate on what it is best at and what it should do, because we are envisaging that the national health insurance might be implemented to relieve government from the care part of health, so that it is funded by that pool of funding that will be taking care of the citizens. But now, government in preparation of that, then they should focus now to the issue of the human resources. They should focus on the issues of the equipment. I saw in the statement as well that the minister is talking about procuring some of the beds, the linen, the mattresses. Yes, those things are needed. And in fact, they are long overdue. But our problem as well, we have a problem there. In our statement, we raised the problem to say the problem is, I don't know if the minister was meaning to say whatever he was talking about and the 1.4 million that he was talking about is decentralized or is centralized. Because if it is decentralized, we are going back to square one. We are sitting here with the uniform issue, although it's not an issue at hand today, the uniform of the nurses. That way, during our negotiations, we thought it was decentralized. It was centralized at the national level, but only to find that there is a fighting. Still at the same health council to say that the ones in the provinces, they want these things to themselves in the name of empowering whoever they want to empower. But we were worried to say, we've got the police uniform, we've got other uniforms that are also legislated. Why are they not empowering using those uniforms? They want to use the nurses' uniform to empower themselves. That was our big worry. So we fear that this space, linen, the mattresses as well, might fall into the same category, that provinces would say, these things, let them come to us, and that money will vanish.
I mean, in your statement, you also expressed disappointment with the announcement of the newly appointed review committee that's there to assess and reform the current health policies. Why this lack of confidence in this newly appointed review committee?
Our problem is in the very same statement of the minister, he raised the issue of the policies that have become obsolete. And when we look at the people that the minister have appointed, a lot of them, if you look there, is former this, former that, former that. And our problem when we were discussing was that the minister is recalling the same people that these policies have become obsolete under their watch. So why do you call them? What difference do you want to get out of the people whose the policies that they were in charge of became obsolete under their eye? You're calling them back to do what with those policies? That was our big worry, to say the minister must change focus, look at the people that are active, the people that will bring something new to the department, not recycling and rewarding non-performance. Because to us, it's rewarding non-performance. There's no difference that we're going to see in the same people that is recycling.
Lastly, how can healthcare unions such as DENOSA just effectively be included in national health policy making more in ways that, like within this review committee, you're able to put your pointers across in the minister not reappointing people who policies have become obsolete under?
Yeah, remember, we can give our views at different fora. We can give our views at the network level. We can give our views at the bargaining council level. We can give our views any platform that we find that we can give our views. But those policies, they become very good documents, let me tell you. But the problem is that once they get there, it depends on the willpower, or we can even call it the political power, or any other power that might be to implement those policies. We have got very good documents. If you open them and implement them the way they should be, and the inputs that were made, very beautiful documents. But our problem is that they get obsolete, and we got worried. And the minister is even saying it in his own statement that those policies have become obsolete. Why?
All right, Kwena Manamela, thank you so much for your time and for giving us your reaction to the minister's announcements. That is DENOSA's General Secretary, Kwena Manamela.